Hi. So let us proceed further, and today we will do two very simple concepts. That is the concept of positive health, and I have combined the concept of spectrum of health along with positive health. So we can do them together, and that also gives us scope to answer our questions well. Positive health is, we have seen the definition of health. So positive health is nothing but being the best of physical, mental and social health. So when a person or a group of people are at the top of their all three healths, then we can say they are in positive health. That is why the textbook has used this phrase that positive health is a mirage, because nobody or no group of persons, no community can be at the best of health. There is always a scope to improve further. So the textbook has used three phrases or three words. It has used biologically at the top of health, which is nothing but physical health. It has used the word psychological, which is nothing but mental health, and it has used the word sociologically, that is means social health. So for understanding, just remember that being at the top of all three domains of health is positive health. Combine this thing with your concept of spectrum of health. I will stress here that I am talking of, or we are talking of, spectrum of health, because there is a spectrum of disease also, which we will be doing later. Spectrum of health, you just remember that at the top is positive health, which we have already seen, and the lowest ladder is death. In between, you can fill, or we can fill with our common sense. So always remember these two things, that limits are positive health and the lower limit is death. So if you take what can be above the death, it can be very serious disease, then it can be serious disease, then it can be moderate disease, mild disease, a disease which has started in my body but it has not been diagnosed, and then I go to good health, better health, and the top is positive health. We can always use an example for this. When you will see my notes, I have used an example of coronary artery disease and risk factors to further improve upon these two concepts. So whenever these questions are asked on this thing, you combine the two, positive health and spectrum of health, and give a good example. That way we can manage both our university exam as well as NEET. Thank you.